So welcome once again to our Future Global Health Leaders webinars. This is the 6th webinar that we've had in this series. And today we're going to be talking about adapting professionally during a pandemic. So to start, my name is Stacy Terrell. I serve as a Diversity and Inclusion Manager of USAID's Global Health Technical Professionals Program. And we just wanted to give this disclaimer up front that these materials are authored by our program, GHTP. We're not intending to speak on behalf of USAID specifically or the US government. And to start, we're just going to give a brief introduction, talking about our program. Then we'll give an introduction of all of our panelists. And then we'll go ahead into some already prepared Q&A, and then we will go into our audience questions. So to start, we just want to share what USAID is. So USAID is the US Agency for International Development. It operates in over 100 countries around the world. And it really is the lead international development and humanitarian assistance agency for our U.S. government response. It is primarily here to save lives, reduce poverty, strengthen democratic governance, and help people progress beyond assistance. And all of our panelists that are featured here are members of our Global Health Technical Professionals Program. GHTP is a USAID funded program. It's designed to connect diverse global health talent with career opportunities at the agency. So we recruit and support early to mid-career professionals across a wide variety of technical areas within global health. This support includes professional development guidance and funding, as well as our mentorship program. And a key component of our outreach work as a part of this program is our Future Global Health Leaders program. Basically, this is a program that we created to support students in particular. So we have global health career resources. We do these webinars on a quarterly basis. We share job announcements. We do have a toolkit that we've created. And we really want to make sure that we are creating spaces where students and recent graduates can really engage in global health focused discussions. We also provide basically on a weekly basis on Thursdays and Fridays, we have office hours. So any student or recent graduate or professional can sign up for our office hours to talk for 30 minutes with one of our staff. You can share your resume ahead of time, and it's a really great resource to be able to just ask questions that you might have about global health careers. And we want to make sure, of course, that we have enough time to go into a Q&A with our panelists. So I'm just going to start and give an introduction of who all of our panelists are. They're in alphabetical order. We have Rebecca Briseño Roba. She is our TB Strategic Information Technical Advisor. She is within the Global Health Bureau within the Office of Infectious Diseases, and she works on the tuberculosis team. Then we have Samantha Santos da Silva. She's a country program coordinator within the Global Health Bureau, Office of HIV/AIDS, in the Strategic Coordination and Communication Division. And lastly, we have Sheena Sharifi Abadan. She is the country program coordinator. She's also within the Global Health Bureau, Office of HIV/AIDS, Strategic Coordination and Communication Division. We're really excited to have all of these panelists here to talk about their experiences. And we're going to start off with just me sharing some of the shifts that we've seen thus far due to the COVID-19 pandemic, and then we'll kick off those questions. So I just wanted to highlight some of the things that came out of a recent DevEx COVID-19 survey. And these were some of the observations that they shared. Again, this is a result of the DevEx survey. They asked the community of international development and global development professionals, what are some of the things that they've seen. And here are some of those observations. So obviously a shift to fully remote work and virtual meetings, greater attention to the physical and emotional well-being of employees. We've seen increased career transitions during the pandemic. So some people are shifting maybe due to location, they're shifting their career overall, or they're just shifting within their roles. We've also seen increased workplace flexibility. And then lastly, specific to the global development space, the DevEx survey mentioned an accelerated shift towards the localization of aid work. So we're seeing with the halt of travel that there's been a shift to the localization of some of the programming that's taking place within this broader field of global development. And we will start with this first question. In your current role, what is a typical day like for you? And we'll start with Rebecca.
Hi, good afternoon, everybody. Thank you so much for being here. I'm excited to share my experience. So my typical day will have several video calls a day. Some time to work in deliverables, pulling data, or creating graph and visuals for data analysis, and reading, responding, and managing emails and requests. Yes, I think we sometimes I forget the emails take some time too. You have to be on top of your emails. So that's my three things I do in a typical day.
Thanks. And next we'll go to Samantha.
Hey everyone, I'm Sam. Sorry if you hear some background noise. There's some lawn work going on outside. Thank everyone for being here. My workday is pretty much the same. Also, I'm waking up, I log in. It's kind of nice when you're working from home and your workplace is like just one door away. So logging in, checking my email, checking in with my supervisor. I really look at my calendar to see what do I have planned for the day, what meetings do I have to be at, and then make sure, did I do all my data analysis before I'm getting into this meeting? So that's pretty much it. And then any requests that are coming in, once Sheena talks also, you'll see that we're both in the same position, but our jobs are pretty much different. Our days are different depending on what country you're supporting. So I support South Africa. So just waiting on requests for them to come in throughout the day.
Great, and we'll go to Sheena next.
Hi everyone, my name is Sheena. Nice to virtually meet you. Sam gave a pretty good overview, so I'm a country program coordinator as well. I support Kenya, and I also live on the West Coast. So I work on DC and Nairobi hours. And so I would say, in addition to everything that Sam said, it's a lot of communication from all levels. So in our role, we serve as the main headquarters liaison for our country teams, which means at any given point, we're fielding communications from our teams in country and helping them with any requests, whether it's data, staffing support, any meeting they need to hop on a phone call, a lot of communications with different headquarters liaisons by technical area. So that's done via email, via phone calls, video call, a lot of GChat. And what that means is that we have technical counterparts. So somebody who's a specialist in HIV prevention, HIV care and treatment, et cetera, in which Kenya, for me, is one of their backstopping countries. I'm sort of their go-to person so that they can ask me any questions related to the portfolio and I can help connect the dots for them.
Excellent. And the second question that we have is, how have your work priorities and overall experience shifted because of COVID-19? And we'll switch it up and we'll start with Sam.
Okay, I'll go first. Overall, my experience has shifted because of COVID. I'm used to being out in the field. So I'm used to being really technical, hands-on, implementing interventions. So because of COVID and not being able to travel, it's trying to do everything from home. So I think that that was a big shift and adjustment for me, because I am a people person and I like being around, and I learn best around other coworkers, and actually being hands-on. So because of COVID, I had to learn how to, one, work alone in the sense because I have nobody around me, and really learn how to prioritize the things that I have to do throughout the day. There's not somebody there that may say something and that reminds me, oh, I have to get that done. Like I really have to, okay, what am I doing today? What am I being asked for? What was asked of me yesterday? And then going from there. So I had to, I want to say in a sense, learn how to work again in this virtual setting.
That's a great point. We'll go to Rebecca next.
Yes, so I will split the question in two, like the work priorities. It just changed and over the last year because, at the beginning it was trying to understand, like everybody understand how it's like here in Washington, the Washington team to understand how to work in this 100% virtual environment. That was the first few weeks. And then when the pandemic started hitting our field, the countries where we have programs, it started then to try to mitigate the challenge the field had, the different challenges that they were facing because of being, in quarantine or being, also teleworking. And then was about when the pandemic really hit the field, it was like about measuring the impact of COVID and the pandemic in our programs. So we sent out surveys to the field to understand what was going on, and also while we wait for the regular data to be released. And then, well, the the ugly truth came out, and we saw how the impact of the pandemic in our service delivery and how much it set us back in our objectives and goals, and in global health and in tuberculosis and TB, HIV. And now we are in the recovery phase. So within the TB division, the recovery plans were created, and now we're implementing that with the field to try to go back to our previous years. But well, the pandemic was devastating in some countries, setting us back 10 years of progress, basically. And now my work experience, I started working a week after the shelter in place started. So I started working when everybody was virtual, and it was very different from everything, of course, that I have experienced before. Yeah, I had to learn, new skills and new procedures, and knowing my coworkers and colleagues all in the environment and in the virtual environment, and it was challenging. I won't lie, it was challenging. I think as Sam say, being around people, and also for me, it wasn't like I didn't know them, so I didn't have the social cues of that you have when you meet someone in person, and how to reach out to them, how are their style, their management style, what kind of communication works for a different person. So yeah, that was challenging, but well, we are all here, so we did it. Thank you.
We'll go to Sheena next.
Thanks, Stacey. I'll focus on the work priorities section. So I think COVID-19 also within the development community, and certainly at USAID, presented a time for us to also sort of zoom out and think about our overall impact. So to give a concrete example for that, Sam and I work in the Office of HIV and AIDS, but we do coordinate with our colleagues in TB, and to an extent malaria too, because when you go to a health center, ideally all of these services are being offered in an integrated manner. So now with COVID-19 being an emerging infectious disease, that now has to be absorbed into the health system. So even though we're country program coordinators for HIV programs. We do have to pay attention to what's going on in COVID, what funding is coming into the country, is there any available data on case rates, et cetera. So that's definitely been an added part of our portfolio, and also, time to just think about like integrated health systems and how is USAID making an impact there. I also wanted to touch on the importance, I think, during this period of efforts around anti-racism, diversity, equity, and inclusion. For my portfolio specifically, it has changed during COVID-19. I'm remote, just like Rebecca and Sam are, but I've been able to be more involved in anti-racism and DEI efforts as USAID also thinks about that impact, not just at a headquarters level, but about the power differentials between our roles as headquarters staff and our mission staff as well.
Thank you all. Our next question is, many of you spoke about the shifts that have happened, and I want to ask what skills have helped you navigate these shifts. And let's start with Rebecca again.
Thank you. So yeah, the skills, I will say the first one was being organized. I realized after a couple of weeks, like I wasn't being as productive as I was expecting. And I know, it was a new job. It was, as I say, a new skill set that I have to develop, but still like something was missing. And I realized that it was the commute. So the commute was a transition period for me to stop thinking about my personal life, my household, and I start thinking about work and my priorities. So I didn't have the time. I need that. I needed, but it was difficult to get. I also have 2 little kids, so it was like almost impossible to have that buffer time between I wake up and then I start working. So I developed like a new routine, like every day before I log out, I check what are my priorities for the next day, what things I have pending, I write it down. I also check sometimes before logging out, but also like before going to bed, I check my calendar to make sure I'm not missing any 6 a.m. meeting, because one of the main changes also of being virtual is like we're expected to be in all places at all times and meeting after meeting without much like time in the middle. So I didn't want to miss a 5 a.m., 6 a.m. call with the field. So I have to like check, before I go to bed to make sure, set my alarm. So that was the main one. And also asking a lot of questions, like losing the fear of asking questions, of make sure that I understand what was requested from me, and making sure I understand what are all these new things I was learning. And I also say my third one would be like, I also learned like new ways to engage with my coworkers. Again, like because I didn't know them, I didn't know how they were in real life. It was difficult to get ideas of how to engage with them. So I use now chat. I think Sam or Sheena mentioned like the GChat. The chat function is like a quick stop by your desk kind of thing. If I need something like kind of urgent, but I don't want to like set up a meeting. I just like, or I don't want to send an email that is going to get buried in the hundreds of emails a day. So I just send a chat, but some other coworkers will be more responsive by email. So learning new ways to engage with my coworkers also was also key. Thank you.
Thanks. And we'll go to Sheena next.
Thanks, Stacey. Communication. It's difficult to recreate in-person communications virtually. It's not impossible. We have Google Meets, we have this lovely Zoom meeting, but it's optional who turns on their camera, who doesn't. Somebody might be in transit. They may have childcare and sort of be, distracted and trying to handle a lot of things at once. So I think what skills has helped me the most navigate the shift is just being very clear with my communications. If it's via email, if it's on GChat, by phone, and just helping to set expectations, being really clear, like, this is what I'm working on today. Here's the part that I can get done. What is the deadline that you need? I'm not available that day. I'm truly out of the office, etc. Just sort of those things that I think are really quick, and in person, you don't even think about them because you say it as you stop by someone's desk or you see them in the hall passing, like, reminder, this is due tomorrow. But just remembering to be super, super communicative and clear. I think in our environment where we work at USAID, it's very fast paced. So it's important to be like really clear in your communications and be in touch often so people know where you're at and what you're working on.
Thanks. And we'll go to Sam next.
Okay. One of the skills that's helped me navigate these shifts is my ability to be adaptable. I think during this time, especially during telework, you have to learn how to adapt, whether that's using new technology, just being completely virtual, learning different communication skills. You have to be able to adapt to those things. And like Sheena said, it's really fast paced at USAID. So you have to be able to change on a dime. Another skill that's helped me navigate these shifts is I am really good at setting personal boundaries. And I really, Sheena knows, I really have a work-life balance. So I am on, and I know some people may have, like a different schedule, but I'm on 8 to 5. And I log on probably like a little bit before 8 to send my email, check what I have to do and get to work. And then at 5 p.m., I log off. So if it's not life and death, like truly life and death, the program is collapsing and am I the only person who can save it? I'm not answering it after 5 p.m. I will see you in the morning. and I think that that's what needed, because as Rebecca said, like there's not that commute anymore. And I was used to having a very strict schedule, waking up, working out, going to work, coming home. So to not have that where I said you can just roll out of bed and get to work, I think that was like making the whole experience, that telework, really like mushy. I'm going to use the word mushy. It was really like just, it all blended together. So I just had to set those boundaries, set the times, and just learn how to be adaptable in this situation.
Boundaries are definitely key. Our next question is, again, we're not trying to predict the future. This is strictly just based on, what maybe has been working so far. What shifts do you think will remain in place for years to come in terms of whether it's priorities from a work perspective or like the workplace itself? And we'll start with Sheena.
Okay, this is a great question, Stacey. I think that there will be some element of remote teams for years to come, and certainly that flexibility. We know that having that to help with elderly care, child care, just balancing if you're in a different time zone. Like me, I'm on the West Coast. Most of my immediate headquarters colleagues are on the East Coast. I think that will remain in place for years to come, and I think that it's a good shift. And to be honest, I think that will allow the public sector to keep up with some of the benefits of private sector as well, and draw more talent into our field. And I also think a focus on more local implementing partners and moving sources of decision making, sources of power, and ultimately resources, meaning financial resources, to locally led organizations and countries will be a permanent shift. And we're seeing a lot of good literature about that right now. And so looking forward to those articles and theories and implementation approaches being put into practice.
Thank you. We'll go to Sam next.
I'm going to piggyback off Sheena. I definitely think that the telework status will remain in place for a few years. There are some people who are way more productive teleworking than going into the office. So I think that there has been a lot of increased productivity from certain teams. I also think that it benefits a lot of companies financially, space-wise, when people can just stay home and telework. I also think it helps the environment. So, because we're not driving as much. And I really think that it really helps the individual themselves, because sometimes it may be stressful for people to actually go into an office to be around people. So I do think that employers have seen that this shift to telework really has more benefits than, just one.
Thanks. And we'll go to Rebecca.
Yes, I was going to say the same. I think more flexibility in the work schedule for sure. I think telework is here to stay. I am an extrovert. I love to be around people, and I miss the office environment, and also have that division between my personal life and my work life. But I have to say that you can also have, as Sam was saying, like a better work-life balance in many cases, and I feel like it's going to stay. Like some flexibilities are going to stay for sure, and yeah, all the benefits with the environment, and I think that we might need to go to the office. Like we will have like a hybrid. I think in many companies, and because I think we still need the social time and the social interaction to also feel like we are part of the same team. But it's true that the benefits of teleworking are also like now undeniable.
Thank you all. And our last question is, if you have any advice for students or recent graduates that might be having a difficult time finding work opportunities during this pandemic. And we'll start with Sam for that one.
I would say be adaptable, remain flexible. I think that the work environment is constantly changing because of the pandemic. Even though we're getting better, we're not at the best, or we're not going to return to what normal is. So being able to understand that there is that shift happening and to be able to fall in there. Putting yourself out there. I think because a lot of things have moved virtual, a lot of opportunities have opened. Like I said, they don't need space in an office for you to be there. They can just send you a computer and you can just work from home. So I think that there's a lot of opportunities to gain skills from there. And I know that now things are starting to open up. So there is some traveling happen. So there's also that opportunity if you feel comfortable traveling. A lot of people don't. If you feel like I'm vaccinated, I'm taking the steps that I need to prevent myself from contracting COVID, then there are organizations looking for people to travel again. So if that's something that you're open to, reaching out to those organizations and be like, I'm able and I'm willing, because that's me, I'm able and I'm willing, send me out somewhere. So, but it's a preference. And I think that may put you a step above others because they can use you right now in the field where the work is actually happening.
Sam, and we'll go to Rebecca next.
Yes, I was thinking about it, and I will say also networking. I remember this was the advice that were given to me 10 years ago, and I didn't like it, but now I know that it's true. And it's not only networking to know important people, or to know when they're going to be an opening and they give it to you. It's networking to understand the field that you want to work on. And as Sam was saying, it's changing, it's changing. The world is changing so much that it's important that you stay in touch with people that are working in the field that you want right now. And ask questions, ask questions about how is the job, how to apply to the job, what are the skills that are needed right now. And not only like networking, not only through LinkedIn or your peers, but also think about friends of friends, even your teachers, or even your parents' friends. Somebody might give you an advice. It's not networking is not only to know. It's not only because it's not only about getting a job, but also to understand the whole picture. So that would be like my main advice. And also, as Sam would say, like think outside the box. Start applying to jobs in places that you didn't think that you were going to live in. And of course, ask about teleworking agreement, and maybe a place that you would like to visit, at least in case you have to go. But yes, start applying to jobs that are not in where you are, in the virtual world.
Thanks. And we'll go to Sheena.
I agree with Sam and Rebecca wholeheartedly, especially what Sam said about being willing, adaptable, flexible, especially what Rebecca said about LinkedIn. It's your best friend. Cold call people, meaning via the chat, just send them a message. People are happy to talk about their role and help you out. I think one thing I would add too is as you look at positions, try to spend a little time jotting down like your specific why. Like, why does this role interest you? Why do you want to apply for it? And I think that can help sometimes when you feel like graduation's coming up, I just need a job. I'm going to take whatever, I'm going to apply to like 300 things and see what sticks. That method does work sometimes, but then when it comes to the interview, you're still going to have to explain why you're applying for this. So I think that can be sort of a helpful journaling and sort of self-intention setting exercise. The other thing, in addition to being really clear on your why, is to also think about non-traditional things. So maybe your first step after graduation is an internship. You can ask, okay, this says 3 months. Could this extend to 6 months, a year? What about part-time remote opportunities? Maybe you have to do 2 to 3 of those. I think sometimes those experiences can also be really, really valuable and afford a little bit more flexibility while you're trying to figure out next steps. So if it seems really difficult and things aren't sticking for like a full-time role that's benefited, et cetera, think about what are other ways that might be an entry point to do work. And if you have a couple different internships at the same time, that may also give you a flavor of different areas of global health and may help direct next steps too.
And then really quickly, Stacy, if I can just add, think about any skills you have outside of public health and how that can be applied to public health and how the field is changing. So even if you don't get a job right after graduating that is in public health, how can that position put you a step above, the next person who just graduated? What can you bring to the field that's going to be different, that's going to be innovative? So I think expanding that job search also, and making sure that, wherever you're going to go is just going to help you develop skills that can be used after. So I think that would be good to do.
That's all excellent advice. We want to make sure that we open it up for questions from you all. So you can either use the raise hand feature, or you can put your question in the chat. We're happy to take them. Okay, so we've got one question. So feel free to unmute and feel free to ask. Rachel?
Hi, everyone. Apologies, I've left my camera off. I think we all need a little break from the Zoom camera all day long. I have a question just more broadly about how you see hiring trends returning after the pandemic, specifically related to the field experience component for so many jobs in global health. As so many of us students in either undergrad or graduate school right now are limited in our opportunities to engage in field work or research, academic pursuits outside of the US because of the travel restrictions. Do you feel like some of those requirements will be eased, or there'll be more flexibility in those minimum 1-2 year requirements?
So I'll just give the perspective from at least GHTP position descriptions that you'll see. Ours do not generally have an overseas work experience requirement. Usually the language is pretty expansive. It'll say something like experience working in a resource limited environment. So that could be that you worked, in a nonprofit that had a really limited budget and you had to stretch it. So we try to make things as expansive as possible. But I don't believe for at least our positions that you'll see like must have 1 year overseas or must have 2 years overseas. Although I know that it's very, very common within the industry.
Thank you for that.
And I don't know if others wanted to add to that conversation. It's something I think that's ever present. We see this, you need to have this many years of experience. Well, then how do you get those years of experience overseas? And I think, as Sheena mentioned, a lot of both organizations, not just USAID, but overall are really thinking about issues of equity more. And so having that be this end all be all requirement, I think you're going to see less of that in the future.
If I can add, like, I remember that struggle too, when I was graduated, like, yeah, they want 2 years of experience and I'm just graduated. How am I getting anywhere? And I think was Sheena or Sam mentioned, that's why also internships are good. It's a good tool to, to have a job, and that will give you some face time also, probably in our organization that you would like to stay, and will give you the experience too. So I will highly encourage like finding internships that in the area that you want to work or you want to explore, or in a company organization that you like.
And I
Say
think
those.
from Alex, sorry.
Sorry, Stacey. I was just going to say that actually is a really good question and it didn't cross my mind. And I think because I was able to get that experience. But I do know like my international experience first started off with Peace Corps. So I did 2 years in Cambodia. And I know that a lot of people usually go that Peace Corps route to be able to get that international experience. But I know that now they just restarted Peace Corps, and it's more, I think this is like the second or third time they've ever had to do like domestic. But they're still having some assignments where you can provide virtual support for countries overseas also. So that may be something that you can look into, and just try to do that while you're waiting to see how the workforce changes or the requirements.
Excellent point. I see we have a question from Alexandria, and then we'll go to Tiffany after her.
Yes, so my question is, everything was spot on so far, and I've already reached out for networking, but my thing is now I'm in the same boat as the student before me, like in trying to find experiences for internships. I know Samantha just mentioned the Peace Corps. I know the STAR internships. I've applied to those, haven't heard anything back, but it's life. So what other organizations can we look for? Other than those, because those are the only two that I've been exposed to, is STAR and like the Peace Corps. So what other organizations could we look to for those global experiences?
So I have an answer for that. If you do go to the CDC website, they have a portion where it's all internships, fellowships for undergraduates, recent graduates, and postgraduates, like postdocs. They have one of the fellowships there. It's like the CDC PHI fellowship. That is like a 1-year fellowship that you're able to renew up to 3 years. It's in different areas of public health. So whether it's EPI, I'm not sure if they had policy, but like EPI, PEPFAR, other infectious diseases that you can do. So I think that their cycle may open in November, December. That's kind of when the application starts. So I think that that's something good to look into and figure out, how are you going to get your application done? What essays are you going to write? And reaching out to any PHI fellows that have done it before. But I know that that website is really, really good.
Thank you.
I can also add to another good resource you could check out. It's either idealist.org or idealist.com. The American Public Health Association, APHA, also may have good resources for looking at global health, public health, international development, internships. And then if your school has a career development services office, or if you were involved in any research, you could also look at that and see like, are there any short-term assignments to serve as like a post-grad research assistant that may have a stipend or are paid, and have any sort of travel opportunities linked to that once COVID restrictions start to ease, et cetera. So those might be some other areas to look at. And I would also do like a Google search for anything that's related to COVID. So like COVID-19 remote coordinator support, or doing case consulting or contact tracing, et cetera. There are a lot of those sort of acute needs right now that you may be able to participate in the short term too.
Okay, thank you.
And we'll go to Tiffany next.
Hey everybody, thanks for hosting. I'm at work right now, so my camera's off. Really appreciate the diverse panel today. I guess my question has somewhat been covered by the other attendees today, but I'm in this awkward situation where, you know, I graduated from undergrad a couple of years ago. I have some working experience in public health with one of those CDC training programs, the Public Health Advisor one, which, you know, I can recommend. But now I find it difficult to transition from this early career to more advisor roles or more mid-career roles. Everything from the GHTP website is always a minimum of 7 years of experience, and I just feel that it's difficult for me to make that jump other than waiting out that time, and just looking for experiences on how to bridge that between like being an recent grad intern and then all of a sudden being an expert specialist in the field. So that's something that I'm personally struggling with right now.
I can, sorry, unless Stacey or others have, I can try to answer this one for Tiffany. Okay, so Tiffany, thanks for sharing about that. I would recommend checking out program analyst roles. If you're familiar with the GS scale, they typically fall between GS 9 through 12. So it is still in that sort of early to mid-year, mid-career range. And they typically require between 3 and 5 years of work experience. So that's something that you can look at. There may not be a ton of program analyst roles on the GHTP mechanism. I'll defer to Stacey for that, but there are other USAID ones. You can check out Social Solutions International's CAMRIS, and just, you know, do a Google search of USAID contractors, USAID program assistant program analyst roles. You could also look at short-term consultancies. There's a mechanism called GHTAMS. And so that tends to be more expertise based and may not have as strict requirements on the years of experience. And they can be 3 to 6 month consultancies, and a good way to sort of build up the experience base you would need to then transition to something that's an advisor role or above.
I was gonna say there's also, as Sheena was saying, that program analyst position. A lot of people come into that position and then work their way through USAID. And because they have those skills, which are more technical, you know, they start branching off with other teams. So like, yes, Sheena and I work with PEPFAR, but we also liaise with TB or infectious disease or some other, you know, another department or different backstop. And then from there, you're developing those skills and you're concentrating in that area. So then that can present an opportunity. You know, if an opening opens up on that team, they're like, hey, we know you, we know the work that you can do. Let's see if we can get you here. So I would definitely do that. And I think also just, I don't know, just any opportunity that you can get your hand on, like really just dive into it. Like Sheena said, there's a lot of COVID work going on. So if you can get into any of that, you know, that puts you one step above other people because you are now becoming a COVID subject matter expert. And then, you know, also the wording that you use on your resumes, and don't discredit any experience. So yes, you may have experience that was in undergrad, but those still may have the same skills and the same responsibilities that you're going to be doing in another role. So you want to make sure that you document all of that, because experience isn't just, I graduated, I worked for 2 years fully. No, it goes back. You know, I was working at my school in the chemistry department, like from an undergrad up until my graduate degree. But I was working in the front office, so I was getting a lot of skills in budgeting, financing, logistics, supervisory skills. So all of that was able to count towards my experience as well. That's outside of public health. So make sure that you're adding all of that in there.
Yes, if I also jump in, the advices are good. Like I was thinking, if it's USA that you want to work with, or another institution, like I think it's starting, like even like an entry level position will help you. Like you will develop. Speaking just USA, like even the program assistant role, like you have a lot of opportunities to get your hands on technical work because everybody is so busy, and even more than ever now in the global health office with world pandemic, that is very useful to have somebody that wants to learn, and then you can give more responsibilities to that person, and then you will get that face time also, and not only your CV words speak for you, but also yourself and your work, and it will be easier also to jump into another position because your supervisors will know you. There also USA have opportunities like country teams that are not specific on your role, but you can be part of a country team and know other co-workers that you don't work at all, that are not part of your division or even your office, and that will help you to have the experience, and also to have people that will advocate for you in another when a new position comes. Yes, I was thinking about something else, but now I can't remember. So.
And we'll also make sure to share, we have a link that has if you go to our website and you look at USA Global Health Career Opportunities, we have direct links to the other programs that were mentioned. So the STAR program, as well as GHSI 3, which has both program assistant and program analyst roles. We do also sometimes recruit for program analyst roles. Usually the minimum requirement is like 5 years of experience, but as was mentioned, experience is experience. Doesn't matter if it happened during your undergraduate career, anything that contribute to those skills that they're looking for in the job description. So really be expansive when you think about your professional experience overall.
Yeah, I remember what I wanted to say. It's related to what Sam was saying. Like I had experience a full 5 years career before getting into global health, and it was in cultural affairs and public diplomacy. And you will think that that wasn't relevant maybe for global health, but in fact it was. Mostly because I also had programs, and we have to do monitoring evaluation, even if they were not global health programs, even if they were overseas programs. And also, it's experience overall. So yeah, I think you have to think outside the box and think what can be included. Like my work in public diplomacy was also we did a lot of promotions and visuals and stuff, and now I'm working with visuals and graph and data, which is looks separate, but it's the similar principles that you have to use when you are doing an advertising for an event, and when you are bringing a graph. You have to think about your audience, you have to think about the colors, what is that, if it's the message is going through. So all those things are part of your experience. So yeah, you have to think outside and outside of the exact requirements they're asking, and think about what you can bring to the position.
Thank you all. Do we have any other questions, either via chat or folks want to use the hand feature? Maybe not. I did just want to share some additional resources. I see Tiffany just mentioned that she's been considering consultancy, so she's going to look at GHTAMs, and happy to hear that experience is experience. So it's great that we're reiterating that, you know, your resume is, you really have to, you know, just sit and think about all of your previous work experience. So that's good to see that that was helpful. I did, you know, in the meantime, while we see if we have any other questions, I did just want to share some resources. So in addition to the toolkit, this is a link to access the toolkit here. I'm happy to share. We do have resume templates, resume tips, and we have a whole sheet that's just global health career resources. So if folks are looking for spaces to find work opportunities within the field, hopefully these resources will be helpful. And then we just have our website at the bottom. Again, if you want like direct links to our opportunities, in addition to STAR and the other programs that were mentioned, definitely make sure to check out our website.
I want to add, make sure you all look also into emergency preparedness opportunities, emergency management preparedness. You'll gain a lot of skills there. You know, they're following the incident command structure. So you're going to learn about logistics, you're going to learn about chain of command, and, you know, a lot of public health programs run like that. So I'm in Florida, hurricane season is coming up. So we know that, you know, if we get a really bad hurricane here, they're going to go ahead and activate that emergency management preparedness. And that's a really good way to get experience in there. Also, there's also like public health sectors of that. I know with COVID, that became a big thing. So you're able to become, you know, a subject matter expert in that, or like an epi or just a contact tracer. So that's another resource to look into for experience. And that's usually really quick, and it shows how adaptable you can be, how quickly you can get out to the field, and how committed you can be, because it's not easy, emergency management, but yeah. So, oh, okay, Tiffany. So, you know, so sometimes you have 21-day schedules of 12-hour days, but it's all worth it. And you really develop, you know, really, really good skills.
Excellent. So I think unless we have any questions that come up, I want to just take this opportunity to, again, thank all of our panelists today. We've gotten a lot of really, really great advice and really good perspectives. So just want to thank you all for joining us today. And yeah, once again, feel free to, our website is also the platform to sign up for office hours. So if you had something as a part of this conversation that was triggered and you want to ask more questions and talk with someone one-on-one, please definitely feel free to sign up for those office hours. And thank you, Sheena, so much for reminding me. You know, our panelists have shared an hour with us today, and many are definitely open to being contacted on LinkedIn. So please take advantage of the advice around networking that you heard today, and act on it to really connect with our panelists here today. Any other final piece of advice that anyone wants to share before we wrap up?
Don't be so hard on yourselves. It's everything's changing. Don't compare yourself to other people. If you see somebody moving along in their career, everybody's path is different. And I just speak this from experience, because sometimes I would compare myself to my colleagues, and then, you know, eventually we're in the same space. So, you know, everybody's path is different.
I was going to say to reach high, you know, don't limit yourself, and apply, and yeah, check, and the check where do you want to work and apply there. I mean, like, dream big and do your homework, and trust yourself.
I'll just add to, just give yourself a pat on the back for showing up today amongst your busy schedule and taking advantage of, you know, a free opportunity to learn more. And as you see them, prioritize them and go to more and more things like this.
It's a great great note to end on. So I thank you all for joining us today, and we hope you join our next webinar. Thank you.
Thanks. Bye-bye.